course, is the Acupuncture Evidence Project, which we've talked about. And one of the ways in which you can use this is to pick a particular topic, particularly one of the big 8 or the 38 potential positives, to focus on in a blog or a social media message, something you want to put out there about a particular condition. And so where the evidence is strongest, that's the stuff about which we should be making the most noise. So drawing from this graphic, you can share this with other health practitioners, for example, or you can just draw out information if people want to know about a particular condition. You can let them know about the evidence levels, but generally speaking, my clinical experience has not been that patients walk in and go, can you give me 6 references on how acupuncture goes for lateral elbow pain? Usually they'll ask something more like, have you ever treated anybody with tennis elbow before? And if so, how good is acupuncture for tennis elbow? They're more likely to ask something like that. It's more in the advertising that you need to be saying lateral elbow pain, potential positive according to the evidence, or moderate to high quality evidence for lateral elbow pain. Or, as I say, you can write a blog to stick on your Facebook page or your social media page or your clinic website. This is how good the evidence is for acupuncture for lateral elbow pain, and make it a popular language blog, but include the references. And so you can either reference the Acupuncture Evidence Project itself, or you can go to the original references at the back of the Evidence Project and tag what you're saying with those original references. This is a white paper that was put out by the Acupuncture Now Foundation. For those of you who may not be aware of the Acupuncture Now Foundation, this is a not-for-profit charity founded in the US by originally Matthew Bauer, Catherine Berry, and Mel Hopper-Koppelman. I joined them fairly early on in the piece. Catherine and Mel have now both stepped back from the board of ANF. They're still on our board of advisors. They're no longer on the executive, and so these days it's Matthew and myself. And the goal of the Acupuncture Now Foundation is to put the message out there to the public, to health regulators, health service providers, insurance companies, governments, and other health professionals about how good acupuncture is based on the evidence. So getting the evidence-based messages out there. So this is the first white paper we did. And so the title Acupuncture More Than Pain Management was designed to let people know that there's evidence that acupuncture is good for a lot more things than pain management. And in producing this white paper, we obviously got the cool dude on the cover because I saw his face on a bus on the Gold Coast advertising a doctor's surgery the other day. So obviously he's the face of the moment. Anyway, you can download this as free from that tag there on the bottom of your screen. And the good part about this as a resource is everything is reference tagged. And so through the text, it's got the superscripts here, and we have the references all appear in there. So if you find a statement anywhere in the paper, you can find it reference tagged. That also means that you can, if you want to use this as a secondary reference, you can use the Acupuncture Now Foundation white paper as a reference, or you can look it up and use the original references all given here in a similar way to the Acupuncture Evidence Project. This has been a recent submission, basically. So it's a position paper, but also a submission to the Food and Drug Administration in America with regard to the use of acupuncture in pain management, particularly in the context of the opioid epidemic in America. And so again, there is a lot of research reviewed in here on acute pain, on chronic pain. There's a short review of studies showing acupuncture can reduce opioid use when used in conjunction with opioids. And studies such as we looked at a little bit earlier, the Tunisian study, Grisser et al. About acupuncture versus IV morphine for acute pain in emergency, and the Cohen et al. From Melbourne, the 4 hospitals where they were looking at low back pain, migraine and ankle sprain, and found acupuncture was comparable to pharmacotherapy. It also talks about issues like workforce and other issues, so the practical issues that would be involved in acupuncture being more widely used in particular the US healthcare system, but of course this has relevance everywhere. Very recently there have been a number of news stories in Australia from the Rural Doctors Association saying that prescription opioid overuse is a serious problem in rural Australia and regional Australia, and that better ways of managing pain are needed, as well as addressing the opioid overprescription issue. So that's another resource that's available to you. Again, you can go through that and pull out the references because everything's tagged there. It's a fairly good review of acute and chronic pain research associated with acupuncture. There is also another paper being prepared at the moment by a collaboration in the States, which includes quite a few of the bodies, American Society of Acupuncturists, ANF, NCC, AOM, and numerous other bodies all collaborating to produce a paper on a similar topic, so acupuncture in the opioid epidemic. So those sorts of resources you can quote and you can use in your advertising. Then we have specific fact sheets, evidence-based summaries, assessments, which are being produced by different organisations. So this is a fact sheet that was produced for ACMA, the Australian Acupuncture and Chinese Medicine Association. Unfortunately, this was published before the American College of Physicians changed their guidelines, so that's not included here. So already this one needs to be updated. The Society for Acupuncture Research has produced a number of evidence-based assessments. Unfortunately, they're only available to members. So they're on the website, but in the members-only section. So if you wish to join the Acupuncture Society for Acupuncture Research, you can access these. So when I checked last, because I was a member until recently, I just haven't quite renewed my membership at the moment, but I will be shortly. Pediatrics, hypertension, hyperlipidemia, rhinitis, sinusitis, asthma, shoulder pain, low back pain, dysmenorrhea, neck pain, carpal tunnel, headache, irritable bowel, Bell's palsy. So you notice a few of those. So the rhinitis, the low back pain, and the headache are included in our big 8, but there's a number of conditions here that are not part of those 8 primary conditions. This is an example of one of their EBAs, as they call them, evidence-based assessments. This one is the long version for shoulder pain, so that's about 28 pages or something like that long. And then here's an example of patient type handout. So these are much more suitable for clinic use, so you can hand them out to patients. They're in a more vernacular style, but of course they're all still fully referenced. And so producing sheets like this really does take quite a high level of skill, because in translating from the academic research language into popular language without making mistakes, without significantly shifting the meanings of some of the research outcomes, that can be quite a tricky business. And so that's not something that the average practitioner would be wanting to take on. And so having resources like this that have been produced by people with a lot of knowledge of research is a great service. It's very handy. And so these handouts, again, these are only available, I believe, I'm not quite sure about that, but I'm pretty sure these patient handout sheets, again, are also only available to members of Society for Acupuncture Research. The British Acupuncture Council has a website on which they have 60 fact sheets for different conditions. They're all free. However, these are a little bit out of date. And also, given the discussion we've just had on what is and isn't acceptable evidence, the way in which these fact sheets were written, because of when they were written, wouldn't necessarily satisfy all of those requirements. So the British Acupuncture Council is looking at having revised fact sheets, but not necessarily doing it all by themselves. We now have an international collaboration where we're trying to produce these fact sheets or evidence summaries through an international collaboration. And so that international collaboration these days is being coordinated by evidence-based acupuncture. So this is Bartosz Ślemnicki, pardon my Polish pronunciation, I'm not very good at Polish names, and this is Mel Hopper-Coleman. So some of you will know Mel from her work with the Acupuncture Now Foundation and also some of her videos. Mel is now directing evidence-based acupuncture website. They have recently produced a review on safety of acupuncture. And so that's basically a review of all the reviews around on acupuncture safety. And so that's a very handy resource. They're also in the process of producing specific condition evidence summaries, I think they're calling them. And so there's one on plantar fasciitis, which I think is now completed, and it's planned to do a whole lot more. And so rather than all of the different acupuncture organizations all over the world doing the same job and each producing evidence-based fact sheets, the project is to have all of the international groups collaborating and supporting one process and having all the researchers collaborate to produce these evidence summaries under the auspices of evidence-based acupuncture. On that site, it's also planned, Mel has plans to produce a lot of revision of the existing site, which was established by Bartosz quite some years ago, but to update and upgrade other sections of that site to be a resource for everybody.